So this is a tutorial on the gross anatomy of the muscle system, and in this tutorial we're going to be focusing on the muscles of the head and the neck. First muscle we're going to look at is the frontalis muscle. Sometimes it's referred to as the overall part of a larger muscle called the Epicranius, and if that's the case then we would be looking at the frontal belly. But we'll go ahead and refer to it as the frontalis here, and it's in the frontal region. And so it goes all the way across the head there. If we look at the image to the right, black and white, see the muscle is isolated here. We're looking at the lateral view of this muscle. And the origin is the galea, or the galea aponeurotica. And that's this sheet of connective tissue here, which is kind of like a flat tendon. And so there's the galea aponeurotica. Galea actually means is an old word for a helmet soldiers used to wear made of leather. But the origin is the galea aponeurotica, and the insertion is the skin just above the orbit. So the skin right here, so this would be the insertion here. When this muscle is contracted, it will raise the eyebrows. However, if we relax another muscle that's part of this overall structure here called the Occipitalis, then this muscle can draw the scalp anteriorly. So again, if we fix the galea aponeurotica, we can move the eyebrows upward. If we relax the Occipitalis muscle back here, then we can move the scalp forward with this muscle. Looking at the Occipitalis now, it's in the occipital region. If you're referring to this as part of the Epicranius, then it would be the occipital belly. And here, the origin of the Occipitalis muscle is going to be the occipital bone. So here's your origin. And the insertion would be over here on this side, which is the galea aponeurotica that we mentioned on the last slide. For the action for this muscle, when it contracts, it'll draw the scalp posteriorly. So upon contraction, we'll pull the scalp backwards. The next muscle is a circular muscle around the eye region, and we'll call it the Orbicularis oculi. Orbicularis means the circular, and oculi and related to the eye. So we have one around each eye, and it's this circular muscle overall right here. And if we look at it in isolation, over here on the black and white drawing, you can see that the origin is the bones of the face, including and the cranium, including the frontal bone, and the facial bone, the maxilla. So the origin up here, the frontal, and the maxilla here, and the insertion is going to be the skin of the eyelid. So your eyelids are going to be acted upon by this muscle and pulled on in a way that causes the eyes to close. So the action is to close the eyes. And then we have another circular muscle. The circular muscle is around the mouth, which is why part of the name is oris. So this one is Orbicularis, oris, and that muscle is isolated here on the right, so we can look at it. And the origin of this one is not any bones, but rather muscles. So this muscle is attached to other muscles, and it's attached at their fascia. The fascia is connective tissue, so it's like kind of like the epimysium. So it may be in addition to the epimysium, you have more connective tissue there. So the muscle's origin is there. So the muscles that have been removed in this isolation drawing, we would have origins outward from there, and we would overall be connected to the fascia of those muscles that you don't see in the image on the right. But when this muscle contracts, the insertion is on the skin around the mouth or the lips. So the action would be to close the lips, much like the way the Orbicularis oculi close the eyelids. So this one would close the lips. And then we have another facial muscle called the Buccinator. And the Buccinator is somewhat deeper to some of the other muscles here. And we'll see one muscle here called the Masseter that I'm tracing out in the middle picture on the bottom. And so this buccinator is deep to that. So underneath that muscle is the buccinator. So this is the buccinator here. And the buccinator is actually deep to another strap-like muscle called the Risorius. So the Risorius would actually be running above it, and it's been removed. That's why it says the Risorius is cut in the image there. Now, if we move to the isolation picture here on the right with all of those muscles removed, I'm going to outline the buccinator there. You notice the anterior portion of the buccinator? It kind of looks like it's outlining where the orbicularis would have been. So that gives you kind of a clue of what's going to happen here. So the origin is on this side of the maxilla. So remember, the maxilla bone is all of this bone. All right here is that facial bone where we have our teeth and so on. So the origin is over here with the maxilla, and also part of the mandible where we have some teeth back there. And the insertion is that muscle, the orbicularis oris. So the insertion is on this side, and when this muscle contracts, it's going to pull in such a way that the cheek actually compresses. So this pushes the cheek inward. So that is the buccinator. Then we have a thin sheet of muscle. It's actually located above other neck muscles. It's called the platysma. And all of this right here is the platysma. And in all of our models in the lab, this platysma would be removed, because if it wasn't removed, we wouldn't be able to see any of the muscles of the neck. And so this thin sheet of muscle, you might have seen this muscle if you clench your teeth real hard and kind of tighten this muscle around the neck, and it looks like it sort of pops out of your neck. That's the platysma. So if we look at it in isolation over here, in the black and white drawing on the right, it goes all the way around the neck area, and then comes up to the lower mandible, and even some of the skin up there. And so the origin is actually going to be the fascia of some of these muscles in the upper chest area. So the origin here up above the pectoralis and the deltoid muscle. So all of that is the origin of this muscle, and the insertion is on the other side. So up there towards the mandible and the skin in the lower face is the insertion. So when this muscle contracts, it would pull down on that. So again, the origin for the platysma is the fascia of the chest, the upper chest. The insertion is the mandible or your jawbone, and the skin of the lower region of the face, right? So the action of this muscle is that it can help depress or lower the lip and help open the mouth. This is not a major mover of these structures, but it does assist in these actions of lowering the lip and lowering the mandible. Then we have the mentalis, which the mentalis is found in the mental region, which is there in the chin area. So the origin is the mandible, and if we look at the first image on the left, the colored image, this is actually the mentalis muscle right here, and we have one on both sides there toward the center of the chin, and the origin is right down here. Okay, and so here's the mentalis again. Okay, and then looking from the lateral side, looking at one of the mentalis muscles, the origin again is the mandible. The insertion is going to be on the other side, and it's going to be connected to skin there of the chin below the lip, so just below the lower lip. And when this one contracts, it's going to kind of cause the overall skin to be pulled inward on the face, and that causes the lip to be pushed outward. So the action of the mentalis protrudes the lower lip, or causes the lower lip to stick outward. Then we have the Risorius, which I mentioned earlier when we were talking about the buccinator. So if we look here, number 37 here, that would be the buccinator, and number 38 is running back, and it's this strap looking like muscle there, and it connects in two places. This place over here posterior is going to be the origin. So it's actually connecting to this muscle that I'm tracing out back here. That muscle is called the Masseter. And then you can see up here, here is the Orbicularis we covered earlier. But the Risorius is this muscle, number 38. Okay? If we look at it in isolation over here, picture on the right, and you can see the overall muscle. It's a thin muscle. Again, the origin is over here, but the origin is not on the mandible. The origin is actually the muscle called the masseter. The insertion is going to be the corner of the mouth, the skin and muscle of the corner of the mouth out here. Okay, so that means when this muscle contracts, we're going to pull that corner of the mouth laterally or outward. So this pulls both sides of the mouth back towards the ears. So again, the origin is the fascia of the masseter, that large cheek muscle back over here. And the insertion is going to be the skin of the corner of the mouth, and the action is to pull the corners of the mouth back, straight back. Then we have the Zygomaticus, and the Zygomaticus actually has two parts, and some references will tell you two separate muscles, like the Zygomaticus major, and the reason I put major is because the isolation image in black and white is the Zygomaticus major. But if we look over here at the image on the left, pink one, we have the Zygomaticus major and minor identified. The major is the lateral, and the minor is more medial from there. And they both actually are going to originate from the zygomatic bone over here. So the origin is over here, and the insertion is over here. So when this muscle contracts, we're going to be pulling towards the Zygomaticus. And you can see that based on the insertion, what kind of motion that's going to produce on the mouth. Okay, the origin again is the Zygomaticus, and we're pulling on the corner here. So what is that going to do? That's going to raise the corner of your mouth like when you're smiling. Okay, so again, the Zygomaticus, the origin is the zygomatic bone, and the insertion is the skin and muscle on the corner of the mouth. Okay. The next muscle we have here is located above, which is why superior is part of the name, superioris, above the lip, labii, and it elevates the lip. So that's why it's called levator, for elevating. So the muscle's name is Levator labii superioris, and we have the isolated muscle over here on the picture on the right, and you can see that the overall muscle, as I trace it out here, the origin is going to be right up here near the orbit, and the insertion is going to be again the skin and the muscle just above the upper lip. Okay, so if we say around the orbit, but on the lower part of the orbit, one way we can say that is infraorbital. And what bone specifically? Remember, the maxilla can be found in there, so the infraorbital margin of the maxilla. Remember, the maxilla is all of this bone that I'm sort of tracing out. It comes up here and even extends up this way and comes along there and back this way. So there's your maxilla bone, and so where the origin is up there. When we're contracting, basically, we're going to elevate the upper lip, so it's going to pull upward. Okay, so the insertion would be the skin of the upper lip, and the action would be to elevate. Now let's take a look at the models we have available in the laboratory. You can see that right here, the Zygomaticus would be easy to identify, because here we have the zygomatic bone right here. There's our Masseter from earlier, and the Risorius over here. The Buccinator is right in here. Then we have medial to that, you have another zygomatic bone. Okay, and then right here, this would be that muscle, and you see it comes actually below another muscle that we don't see in our images so far. So this muscle right here would be best identified as the Levator labii superioris. And then we have another muscle on the other side, on the lower lip. So this would be inferior, or inferioris labii. And when that muscle contracts, it's going to pull down on the lower lip. So we're going to call that a depressor, because it depresses or lowers the lip. So the name of the muscle tells you where it is and what it does. What does it do? It depresses. So it's a depressor labii inferioris. And the origin is in the mandible, and it's the lateral part of the mandible. The mentalis was more toward the middle part. So we come back over here to this image. Here's your mentalis here, and the other mentalis, the right and left mentalis. And then over here on the right side of this image here, we have the depressor muscle. So the muscle if I trace it out, there's another muscle that comes along this way, but the muscle overall that I'm looking at is this one right here. So this muscle right here, overall, its origin is going to be more lateral on the mandible, and that's going to be its origin. And the insertion, again, is going to be the skin and muscle around the mouth, and specifically the lower lip. So the insertion then is the skin and muscle of the lower lip, and when this muscle contracts, because the origin is the mandible, we're going to be pulling down or depressing the lip, which is the action there, depressing the lower lip. Then we have the temporalis muscle, and the temporalis muscle, the origin is the parietal bone, but also this is one of those muscles that's directly attached to the bone, and it's directly attached to the temporal bone as well at the temporal fossa. So if we look up here at the limits of the temporalis muscle, here's the origin, and that's your parietal bone, but also the other side of the muscle is attached to the bone directly, and so we get to that temporal bone that's about approximately right there. So the origin is all of this here, and so that means when this muscle contracts along the fibers, we're going to be pulling in this direction. And if we go to the other end over here, we see that the muscle now starts to turn into the connective tissue, overall a tendon right here, and that tendon is coming underneath or behind this process, the zygomatic process of the temporal bone and the zygomatic bone here. There's space behind there, so the muscle goes behind there, and this structure right here that I'm tracing here or shading in, that's your zygomatic arch. So the muscle goes behind the zygomatic arch and inserts right here on the mandible. The mandible has this process right here called the coronoid process. So when we're pulling with this muscle, when it's contracting, it's actually basically pulling, helping to pull the jaw upward. So the action is to close the mandible. And the insertion again is the mandible, which moves. And the specific place of the mandible is the coronoid process and even part of the ramus. The ramus is this part right here of the mandible. That's the ramus. Okay, so if we look over here, we do have the same muscle, and that muscle is going behind the zygomatic arch. But then we have these other muscles that get in the way. These are more superficial, so this muscle goes down and in and behind those to the other side or the inside part of the mandible. Now you do have to be careful because not all of our models will show the temporalis. There's actually a layer above that, and it's been removed in this image right here. So if that layer is on there, and many of the models do, some have one side where you have that layer still there, the superficial layer, and then on the other side of the model it has the layer removed, and you can actually see the temporalis, whereas other models don't have the layer removed at all, and that layer is going to look like this. The new image that just appeared right here has the superficial layer. This is not the temporalis. This is above the temporalis, and it's part of a few muscles here that we find that can actually move the ear. So they're called the Orbicularis muscles, and you can see them in isolation here. This would be the superior Orbicularis, which can actually pull the ear upward, and some people can move their ears if they practice using that muscle. Now this particular model, which we don't have this exact model, but if you look at the other side of the head, it has that superficial layer removed, and there's your temporalis there. So be careful when you're examining models in the laboratory that you are indeed looking at the temporalis muscle, which again works to close the mandible. Now we're looking at the masseter, and for the masseter, that's a muscle I've already mentioned to you before. It's this muscle right here. This is the one that the Risorius was originating from. I remember that Risorius was right there, but we're focusing now on this muscle right here. And you get an idea here of where it's going and coming from. Okay. If we look at the muscle in isolation, the masseter, we can see that it is connected over here to the mandible at the angle and the ramus. The ramus is this part of the mandible, and this is going to be the insertion part. The muscle on the other end is connected to up here that zygomatic arch, the zygomatic bone over here. So when this muscle contracts, we're going to be pulling up on the mandible. So here we have another muscle that helps, or is a synergist of closing the mandible. Whenever we have muscles helping each other, that's called synergy. So this would be a synergist to other muscles that do close with the mandible. So what is the origin? When we go back and look at these images, it is the zygomatic arch. There's your origin. That's your origin. The insertion is the mandible, specifically the angle and the ramus. Here's the angle where the mandible turns, and then the ramus is right up here. And that is the masseter. Now we have two muscles that actually they can help close the mandible, so they are synergists to those other muscles that are able to close the mandible, like the temporalis and the masseter. But these are the pterygoids, and for the pterygoids you have to go inward into the face. These are deeper muscles, and there's two. There's the medial and the lateral pterygoids, and both of them are actually going to originate, and their origins are on the sphenoid bone. Okay, but their specific locations are slightly different, and so if you look closely, we'll see that they are a bit different. So they both are going to insert on the mandible as well, but at different locations on the mandible. Just be able to tell me that it's the mandible, but I'm going to get specific on where exactly on the mandible. And again, the actions of the pterygoids, we're going to cover the medial first, and it's pronounced pterygoid, is the action is going to be to both raise and to move the mandible side to side, like when you're chewing. Okay, so when it says medial gliding, that means when the muscle contracts, it pulls that side of the mandible medially. Okay, so let's look at the image on the bottom left, and we have our lateral pterygoid, but we're going to do the medial pterygoid first. So the medial pterygoid, if we look at the direction of the fibers, they're moving sort of up and downward mostly. And as we move to one side of the muscle, we're going upwards to where it's going to be attached to the sphenoid bone. And the sphenoid bone is the origin up here. And so that means when these fibers are going to contract, the other side is the origin. Okay? And so overall, there's going to be this direction of movement. Okay? But if we look at this muscle from another angle, we're going to look at this from the back part of the head. And it's going to be like if we cut through the skull and remove the back part and look at it from behind, we're going to see this image here. Okay, and so the pterygoid, this is the medial pterygoid right here. You can see that it's actually inserting on the inside of the mandible, or the medial side, because the outside would be the lateral side of the mandible, right? Or the left side. So we're on the left side of the mandible, so this would be the lateral, the outside, and the medial, the inside part of the mandible. So it's attaching there on the inside where the angle is in the ramus, and this is going to be the insertion area. The origin is going to be up over here where the sphenoid is. Okay, and so when let's just say that this one is the left one, because we're looking from behind. This is the left medial pterygoid. If it contracts on its own, it's going to be pulling in this direction, but that includes not just upward, but to the right. So overall, we're going to get this upward and inward, or medial movement of the mandible. So that will cause the jaw to move sideways toward the right a little bit. Now, if we relax that one and contracted the right medial pterygoid, then we would have the opposite action, not just upward, but leftward. So this is where the side-to-side movement comes in. Okay, so again, this is the medial pterygoid. The origin is the sphenoid, and the sphenoid does have a structure on it called the pterygoid process, but it's the sphenoid bone and part of the maxilla that it inserts on, that it originates on. Now, as far as insertion, it's the mandible, but specifically it's the medial angle and the ramus of that of the mandible. So that's back over here. And if you look at the other picture back down here again, you see that's down over here. When we look at the other muscle later, the insertion is in a different location on the mandible. So the locations do actually matter as to the specific movements that are done. So again, the action is going to be to help raise the mandible, but also help move the mandible side to side when you're chewing so you can grind your food. Looking at the lateral pterygoid, you can ignore the image here on the left, the far left, upper far left. Looking down at the bottom left image again, you can see here is some of the part of the muscle, and it actually attaches at several points here. So you have part of the lateral pterygoid originating over here, up where the sphenoid bone is, but also two parts of the maxilla over here. So all of this is origin, and the directions of the fibers tell you the direction of the shortening. Okay. Now the insertion is going to be over here on the back side of the mandible, where the mandible is articulating with the temporal bone up here, but it's on the inside. So when we now cut through the skull and we look at it from behind, which is this image over here, now we're looking at this pterygoid muscle. Okay, so there's your lateral pterygoid, and there's actually no upward direction for those fibers. These are really actually going to just move help move your jaw side to side. So it may not be totally true that it's going to provide a significant amount of raising, but it still can. The real important movement on this one is going to be the medial gliding of the mandible for the side-to-side chewing motion. So if we look, the origin again is the sphenoid, the pterygoid process, and the maxilla, and we can see that direct connection to the maxilla over here on the bottom left picture, and the sphenoid up here for this muscle. And then again, if we look at it from the cut skull, from the posterior end, if the left, and this is the left side, this is the right side looking from behind, if the left lateral pterygoid contracts, right, and this is the insertion, this is the part that's going to move, then we're going to be moving inward. So the contraction of the left medial pterygoid on its own moves leftward. If we relax that one and contract the right medial pterygoid, then that's going to cause a leftward motion. And in either case, those muscles would pull the jaw medially relative to their position. So the left medial direction would be to the right. The medial direction would be pulling the mandible to the left. If we look at the picture in isolation here, there's your medial pterygoid, but again, it's on the other side of the mandible. Okay. Now, that's it for the muscles that you know for the head and face muscles. But now you need to practice. So at least for this course, there's more muscles in the head and face area, but these are the ones that have been selected for you to know. And so you need to practice. So what you need to be able to do is identify the muscle by name. That means you need to name them. You need to be able to identify them, and ways you can practice is you can practice on your own body, trying to locate those muscles, try to use them, note their actions. You can look at them on models and in the images in your lab manual. And then you're going to need to practice. So you want to recite and write their names and watch your spelling. So if you misspell, practice spelling correctly. So again, you're going to have to name and write the muscle. You're going to need to know the origin and the insertions. You want to practice. If you look at the muscles on the models, a lot of times you'll be able to tell after you've practiced for a while where they're originating and inserting, and that'll give you clues as to how they move, because you're going to also have to tell the action. Now be careful when it comes to action. Don't just tell me elevates, because I'm going to say elevate what, and that's why you need to know the insertion, okay? Because the insertion is what's going to be moved, right, or elevated if elevation is what that muscle does. And another way you might help learn the actions is, as you're going over the actions, you might try to do a little bit of kinesthetic learning and try to move your body using that muscle and checking the action of that muscle. And you may also have some movable models. We don't have very many models that can move, but if you do have a movable model, you can move those models in those ways. So simulate the action of the muscle is another way to do that. So that's it for this tutorial on concluding on the head and face muscle.